Hello, you're welcome back to my channel. In today's video, we're going to talk about malaria, cause of malaria, preventions, and treatment. So, without much wasting time, let's begin. What is malaria? Malaria is a disease caused by a parasite called Plasmodium species. There are different types of Plasmodium species, but the most common one, which is responsible for malaria, are four. Number one, we have Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Among of these Plasmodium species, Plasmodium falciparum is responsible for malaria infections in Nigeria and other tropical countries. So that is what we are going to discuss about. This Plasmodium falciparum is transported via a mosquito. Female mosquito called Anopheles mosquito. The disease is not transmittable either contact or sexual intercourse. Malaria can only be transmitted from mosquito to a human being. Mosquito feed on blood. So when they pet on you, when they have the parasite on their mouth, when they pet on you, they eject the parasite and take blood from you, while the parasite go into your body and develop, causing a lot of destruction. Now, what is the main cause? What does a malaria infection cause in our system? What does it destroy? Malaria parasite engulfed in our red blood cells. That is why when people have chronic malaria, they tend to lose blood, because this parasite engulfed in the red blood cell and start destroying the blood. That is why when people sick of malaria, they start losing blood. Now, how can we prevent these things? How can we prevent malaria in our society? Malaria is preventable and treatable. Personal hygiene is one of the key factors in preventing malaria. Number one, since we know that malaria is transmitted via mosquito, a mosquito, Anopheles mosquito, and this mosquito, how did they come into our society? How did they grow in our society? Mosquito, we all know that they have a congestive environment where they reproduce. Their congestive environment where they reproduce is stagnant water. So preventing malaria in our society is to stop keeping water in open area. Like, we try as much as possible not to allow any drainage water within our premises and our environment. And number two, make sure that your environment is free from grasses. Make sure you weed your environment to make it clean from grasses. Number three, frequent fumigations. Fumigating your house, your environment frequently can also prevent malaria. There are vaccines for malaria for children. So it's advisable that if it is available in your locality, you can take your child to get the vaccine. This vaccine has been known to reduce the mortality rate in children. Most of the people affected with malaria are pregnant women and children. Malaria sometimes can be of severe case, and that is resistant malaria and non-resistant malaria. When we talk about resistant malaria, is a malaria that is resistant to so many drugs. Maybe the person has been using one or two drugs before, or frequent use of drugs. His or her system become resistant to many of those drugs. So when he has the malaria, they tend to use one or two of these drugs, but it's not working. Become resistant malaria. When malaria becomes resistant, it can lead to a lot of things. It can lead to death. because it goes there, it starts destroying red blood cells, most especially in female, pregnant women and children, which has low percentage of blood. So it can go in there and start destroying the blood, and at the end of it lead to a lot of other medical conditions. Now, it is important that you take your children or your child to get the vaccines, or when the vaccine can protect them from the malaria. Number 2, make sure that you use a protected net. Sleep under mosquito net in an area there is excess or too much mosquito. Those are the best way to manage yourself from malaria. So, having said that, we're going to end this video here. If you have any questions regarding to what we just said, you can drop your comment in this video or send me an email or inbox me. Send me a message in my inbox. I will reply you. However, this video is for educational purpose. This is not to substitute for medical examination. So whenever you have any issue regarding malaria or any other medical issue, please consult your health professional. Don't forget to follow me on my Facebook page as Shuaibu, Twitter, TikTok, and YouTube. I'm also on YouTube at Daily Health Guide. So thank you for watching, and see you in my next video.